Good evening, all. Am I audible?
Good evening.
Good evening. Everyone clear with yesterday topics which we discussed? Is there any doubts? Are you guys good? Can I move on to the next topics? Guys, yes or no?
Yes.
You are clear, right?
Yeah, ma'am.
Okay, thank you. Modifier concept, book leading, everything, right? Okay, today I'm going to start the topics. Okay, I'll discuss one by one. If you have any questions, stop me then and there and you can ask. Okay, I'm happy to answer, guys. Yeah, you can ask a small doubt also. 2 minutes, I'll be sharing my screen. Please confirm everyone can able to view my screen.
Yes.
Yes, ma'am.
Thank you.
Yes, ma'am.
Okay, I'll start with the topic debridement. Okay, which is integumentary system surgical. And the CPT codes are starting with the number 1. Okay, this is the integumentary topic, which is debridement. What is meant by debridement, guys? When we can code debridement? What is meant by debridement?
Cleaning.
Yes. Next.
Removal of damaged tissue.
Sorry, Valiram.
Removal of damaged tissue.
Removal of damaged and dead tissue. That is also one of the major point. Next. Any other answers from the experienced people here? Yes, no. Debridement is nothing but it is a process of removing dead tissue as well as the foreign body. So what is meant by foreign body? Anything from the outside into our body, it is called as foreign body. Okay. If for example, you can assume patient met with an accident. Okay. So there is a fracture. Okay. Fracture and also some like iron materials, nothing like something like materials which is harm the patient. Okay, so this is also a foreign body. So in order to remove that foreign body, the provider will perform the debridement. Okay, and also if patient is suffering from ulcer. Okay, and also there is a dead tissue which is covering all the ulcer. So what will happen here, that infected and dead tissue will be stopping to heal that wound. Okay, in order to promote the healing, the provider will perform the debridement. They will remove the superficial layer of that particular ulcer. Okay, so it will promote the proper healing. This is the major meanings of the debridement, the concept of debridement. Okay, we can discuss the code range, how we can code it, and what are the types we have in the debridement. Okay. Here from the 11000. Okay, 11002, 11008, 11002, 11008. Until here, this code range is called as the soft tissue debridement. Soft tissue debridement, which is also infected tissue removal. Okay, if the provider is removed infected tissue, okay, and then you have to pick the codes from this range, which is 11002 to 11008. In this code range only you have to pick it, and we can see one by one. Not every code I'm going to read it, but for your understanding I'll be explaining it. Okay, 11000, which is debridement of extensive eczematous or infected skin up to 10% of body area. Correct? And also we have the additional code, so, which is add-on code. For example, uh, the provider is performed.
Your voice breaking, ma'am.
Ayo. Now, Manish, for everyone, my voice is breaking.
No, you're good.
No, good.
Manish, can you please
No.
check your from your end also network? I'm at home. I'm Wi-Fi connected. Okay, kindly please check from your end.
Okay, ma'am.
Okay, yeah. Here, based on the body surface area, you guys have to code it. The debridement of the soft tissue, which is infected tissue removal also. Okay, for example, the provider is performed debridement of infected tissue, infected skin. Okay, 30% of body area. 30% of body area. How can we code it? If you are not clear with the question, I will repeat. If you are good, I'm good.
Yes, 11001.
Sorry, Sri Lakshmi.
11000
Okay.
and 11001
Now,
times
11001. How many times?
Into
2.
2.
2 times.
2 times. Yes. Everyone is agree with him?
Yes, ma'am.
Yes, yes. Here you need to code the primary code as well as the add-on code. As I already told you, we should not code the add-on code alone without the parent code. Okay. So 11000 one time and followed by other 20% of the body area is there, right, in the question. So for that 20%, you can code the 11001 into 2 times. Okay. For example, 31% of the body area, body surface. Okay. 31% of body surface. How can we go? How we are going to code it?
Into 3, ma'am.
Only 1%, right? Why we are giving into 3? Any other answers?
We have to add only 10%.
If it is additional 1%, no need to code. I'm just confusing you guys in order to make you understand clearly. Tell me, yeah, additional 1%, can we code 11001 or not? Hmm? We can code. Even though it is 1% extra of the body surface area, we can code. Someone said right into 3, that is correct answer. Clear?
Yes, ma'am.
Yeah, okay. Next, 11004, 11005. Okay, here It is not add-on. However, it is a subsequent code. How can we read the 11005 code description? Can anyone? How can we read 11005 code description?
Debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing soft tissue infection, abdominal
Okay.
wall with or without facial closure.
Thank you, Ravima. Yes, that is correct. And that is how you need to read the descriptions. Okay. Yeah. Here, whenever the debridement of skin, okay, perform debridement of skin, external genitalia. What is the code we are going to pick? 11004. Not based on the surface area. Here, based on the anatomical area, you have to code it. Clear? Don't think like here why they have not given body surface area like that. But based on the codes only, you have to pick the code. Like codes. Okay. For debridement of infected skin, of any like body surface area they have mentioned, you can code the based on body surface area. Even though it is a additional than 1%, you have to code an additional code. Okay, that is the conclusion and the guidelines about the 11000 and 11001. Next, 11004 based on the anatomical area, you have to code it, and depth also. Okay, even though all depths are included in this only. Not based on depth and based on the anatomical area, you can code it. And yesterday itself we have discussed 11005 abdominal wall with or without facial closure. If it is like additionally along with abdominal wall, if they have performed external genital and perineum, you can code 11006. If no, only abdominal wall, you can go with the 11005 alone. Am I teaching fast, guys?
Yes, yes.
Yes, Manish?
Okay.
Sorry. Okay, you can interrupt me when I am teaching fast. Kindly interrupt me. Okay. Others also feeling same?
Yes.
Sorry, Seshadri.
You are going speed.
Speed, ah?
Yes.
Okay. Until now, you guys clear, right? I'll try to teach you little slow. Okay. Until now clear, or do you want me to repeat these two CPTs?
Last
Already we
two.
discussed yesterday.
Double
Clear,
one
right?
double 5.
11005 is a debridement of abdominal wall with or without facial closure. Okay. Only for abdominal wall they have performed debridement. You can go with 11005. But no, along with the abdominal wall, they have performed debridement to the external genitalia as well as perineum. All these three anatomical areas is involved in the debridement. Then you can go with the 11006. Clear?
Clear. Clear.
Yeah, thank you. Yes. Next, here we have the add-on code. Okay, removal of prosthetic material or mesh abdominal wall for infection. Here, when we can see the mesh means if the patient is underwent for the umbilical hernia repair. Okay, umbilical hernia repair. In that surgery, the provider, sorry, the surgeon will place the mesh. Okay, now after that surgery or during the post-operative period or after 1 year, if there is a infection in the mesh, that prosthetic mesh, then they will remove it. Okay, so here you can code this is as a additional code, which is add-on code for the double. Use this add-on code in the conjunction with 10180 and also this codes. This codes we can code as a add-on code. Understood, guys? Like to which CPTs you need to code this 11008 as a add-on code? These are the, please check the notes under add-on codes and also CPTs. Okay, in order to pick or code the appropriate codes. Clear? Yes. You are clear, or do you want me to repeat?
Clear, ma'am.
Thank you. Next, a fracture debridement. Okay. As of now, we have discussed soft tissue debridement. Next, we can discuss fracture debridement. What are the codes which is involved in the fracture debridement? Let me tell you. 11010, 11011, and 12. These are only three codes which is involved in the fracture debridement. Clear? Fracture debridement. Whenever patient met with an accident or fall, anything, if patient had the fracture, okay, in that scenario, if they are performing the debridement, that time you can code based on the depth of the skin. Okay, what is meant by depth of the skin? What is meant by depth of the skin, guys?
Skin layer.
Yes. What are the skin layers we have? Randomly you can say it, guys. Even though it is wrong, also no issues. I'll be explaining it. First, subcutaneous, epidermis, dermis, next, hypodermis, which is subcutaneous layer or a fat layer. Okay, after that, muscle fascia, at last, bone. Okay, this is the layers of the skin. So, superficial layers, what are the superficial layers? Epidermis, dermis, and subcutaneous. These are the superficial layers, not deep like muscle. So, whenever the debridement of including removal of foreign materials at the site of an open fracture or open dislocation, okay, if they are performed debridement like that into the subcutaneous level, okay, you can quote 11010. For muscle level, can we code 11010? For muscle level, can we code 11010? Thank you. Yeah. Here, for muscle depth, okay, muscle depth, we have the code which is 11011. And what is the bone level debridement code? 11012. Make sure that you are coding appropriate or correct. Here, why? Because they have mentioned skin, subcutaneous tissue, muscle, and fascia. At last, you can see it is until muscle level. So, if they are performed until muscle level, the debridement, you can code 11. If bone level, 12. If it is a subcutaneous level only, 10. Okay, 10, 11, 12. Last digits I'm saying. Okay. Clear with the fracture debridement, guys? All these three codes.
Yes, ma'am.
Here it is only subcutaneous tissues. Okay. Until subcutaneous level, if they have performed 11010, you have to code it. No, they have performed only at epidermis and dermal layer, which is superficial layers. Okay. Epidermis and dermal layer, they have performed the debridement, not into the subcutaneous level. How can we code? Yes, how can we code? Here you can see for debridement of skin, which is the epidermis and dermal layers, okay, which is superficial layers. You can also see the 97597 and 97598. Okay. You can code either of codes based on the descriptions. Clear? Am I clear?
Ma'am, can you repeat?
Let me repeat. Here, the code we have the fracture debridement until subcutaneous tissues. The first code starts the level until the level subcutaneous tissue. No, they have not performed until subcutaneous level. They have performed only epidermis or dermal layer. The subcutaneous layer will be coming after epidermis and dermis, guys. Okay? Clear? Yes or no? Please. Open image. 1 minute, I'll show you. so that it will be little clear for you. Here you can see this is the skin anatomy. This is the superficial layer epidermis. Here you can see dermis. These are the superficial layers. After this only the hypodermis and subcutaneous, like hypodermis and subcutaneous are the fat cells. Okay, adipose tissue will be there. So here the subcutaneous layer is present. But no, the provider is not performed debridement until subcutaneous level. The provider is performed only dermal layer. Okay, until dermis. How can we code? That is what I'm trying to explain. You can code either of one code, which is 97597 or 97598. Clear?
Yes, clear.
Thank you. And after subcutaneous level, we have muscle, bone. No need to worry and no need to search for other codes. But if it is epidermis and dermis, you can either code either of these codes based on the level debrided. Okay. Next, we can move on to the normal debridement. What are the code range for normal debridement? 110422, 11047. This is the normal debridement. Okay. 1 minute, guys. We can see the normal debridement codes. Okay, 11042, which is first code in the normal debridement. Debridement of subcutaneous tissue, okay, including epidermis as well as dermis, if performed first 20 square centimeters or less. Okay, if it is a 15 square centimeters, 15 square centimeters, what is the code? Like debridement of subcutaneous tissue, first 15 square centimeters. We can code only 11042. Okay. If it is 43 square centimeters, how can we code? It is subcutaneous level debridement, normal debridement. What are the codes we can code? Do you want me to repeat the question?
Yes, ma'am.
The debridement is done to patient, normal debridement is done to patient until subcutaneous level, but 43 square centimeters of the body area. What are the codes we can code?
11042, 11045.
11045.
45? Only one time?
Two
Two,
times.
ma'am.
Why we are coding 2 times?
43.
3
More
square
than
centimeters
square.
is extra, correct?
Yeah.
So even though it is a 1 square centimeters, you have to code additional add on code. Okay. If it is 60 square centimeters, but subcutaneous level, what is the code? What are the codes?
Same
one
one, ma'am.
11042.
11042.
Okay. 42.
And,
Okay. One
and
time. Next.
11045 into 2.
Yes, into 2 because it is a 60 square centimeters in my question. So 20, first 20, 42, next 40 from the 45 into 2 times. Okay. Okay. If the provider is performed the debridement into the muscle level. Okay. Muscle level 55 square centimeters.
11043
Huh?
11046 into 2.
Everyone agree with Kutti?
Yes.
Yes. Okay, let me
Yes.
give you
Yes.
another example. Hmm. In left arm, the debridement is done until subcutaneous level. Okay. 35 square centimeters. Guys, please remember, I don't remember this question, okay? You have to answer. If you want to repeat after, like, very soon I'll repeat, but after, like, you are waited for 2 minutes, again you are asking question, I forgot, okay? So, if the provider is performed left arm, 35 square centimeters subcutaneous level, and uh, right leg, okay, muscle level debridement until the square centimeters is 45 square centimeters. And also remember here modifier also applicable. Which modifier?
50 modifier, ma'am.
Mm-hmm. Okay. Any other
59 modifier.
answer? Sorry, Yashwant.
LT.
59.
Huh? Sorry.
59.
Your voice is breaking for me. I'm sorry.
He said 59.
Oh, good. If it is Medicare payer, still 59.
XE.
Ah, Ravima, think again, please.
Ma'am, separate could no modifier. Layer are separated. No? Muscle layer or subcutaneous layer.
Baliram, you are clear with my question or not? I'm worried if someone asks repeat the question. Baliram, you are clear with my question?
Ma'am, add-on codes 51 and 59 add-on codes do not applicable for add-on codes, ma'am.
Yes. Then what would be the modifier here? What would be the modifier? Sorry, first of all, you can tell me the answers, like the codes for my question. We'll move on to the next topic, guys. Do you want me to repeat my question?
So it
Yeah,
is
ma'am.
Yes, Ravima.
XS for
Oh, you found it. Yes, that is the right answer. For Medicare payer, you have to code excess modifier. For normal payer, which is commercial payer, you can go with the 59 modifier. That is correct. The modifiers are correct, but I want the codes now for my question.
so for arm you said 35
Correct.
subcutaneous.
Yes.
11042
Uh-huh.
11045.
Okay.
So for leg you told 55 muscle
Oh,
double
yes.
1043
Uh-huh.
11046 into 2. And modifier, please help us. To which one we should append?
Ah, yeah.
Nine.
59 modifier also. Yesterday I told you to which CPT you need to append.
So,
No.
which was performed later procedure we have to append.
Yes. Like here, based on the depth, you have to code it. Okay, not the subcutaneous level codes you have to code first. You have to code the muscle layers. Okay, first muscle CPTs will be coming as a primary codes. After that, subcutaneous tissue codes. Okay, why we are prioritizing like that? Based on the depth. Clear? Am I clear?
Okay.
Yeah. And for example, same patient, same session, but debrided all four, like four levels. Not 4 levels, 3 levels, but also fracture debridement bone. If in the question you have like you got like a question the fracture debridement done for the patient until bone level, and normal debridement is done to the patient until bone level, and muscle subcutaneous tissue like different anatomical areas, but the subcutaneous level into like one anatomical area, and the muscle level debridement in the another anatomical area. Okay, all these 4 levels is performed. What are the 4 levels? Fracture bone is different, normal debridement until bone level is different, subcutaneous level in different anatomical area is different, and subcutaneous tissue different anatomical area is different. Okay, like for example, you can assume 4 anatomical areas, different areas in the body, the provider performed in same session all these 4 debridements. How can we prioritize? How can we code it? Am I saying fast, Ravima?
No. So
Okay.
for depth, we have to give the first priority and append modifier.
Okay.
Uh, s- since it is different site, or if it is Medicare means we have to append excess. Mm, Hello.
Yes, guys. Yeah, here if the question contains all these 4 level is involved, the fractured bone level debridement is different, the normal debridement until bone level is different. Here you have to prioritize fracture bone level as a first code. Okay, please write it down if you have notes with you. Okay, fracture debridement of bone, first you need to code it. Next, followed by normal debridement until bone level you have to code. After that, muscle. Next, at last, subcutaneous. This is how you have to follow the hierarchy. Clear? If all the 4 level debridement is done during for the patient during same session like that, you can code the uh, sequencing, and you have to follow the hierarchy. And also another guideline, if it is a different anatomical area and also different depth, different anatomical area, different depth means you have to code the 59 modifier to the like superficial levels only. Like if it is a muscle and subcutaneous tissue, both levels debridement done. But if it is a different anatomical area, to which CPT you have to code the 59 modifier for subcutaneous level. Okay, if it is bone and muscle, to which you have to add the modifier. Guys, subcutaneous. No, Kutti. Let me repeat. If the provider is performed fracture level debridement and also subcutaneous level debridement for the fracture bone level debridement and subcutaneous level debridement in 2 different anatomical areas, to which concept, like to which level you are going to append the 59 modifier? That was my question.
Subcutaneous.
Subcutaneous. Yeah.
If it is if it is muscle and subcutaneous,
Subcutaneous.
Subcutaneous.
if it is bone and muscle,
Muscle.
Muscle.
if it is a fractured bone level and normal bone level debridements.
Normal bone level.
one
Correct.
level.
Thank you so much. Yeah, I thought like you guys are good with the concept. Next, you should not add the 59 modifier if it is a same depth. Okay, don't add the 59 modifier if it is a same depth level debridement. Even though it is a different anatomical area, if it is different, same depth means don't need to add the 59 modifier. If it is a different depth like muscle and subcutaneous or bone or muscle like that, you can add the 59 modifier. Remember, if it is a Medicare payer, you have to add the excess modifier. Clear, guys? Yes, no.
Yes, ma'am.
Different anatomical site. For example, knee and arm. So it is subcutaneous only, both debridement. So we should not append 59. That's what.
No, in this scenario, no need to append. If it is a different anatomical area, you can go ahead and append the 59 modifier.
If it is same site, means
Even though it is a different depth, if it is same anatomical area, we're saying.
no, just now you said
Okay,
that remove.
Ravima, 1 minute, please. If the provider or document provider are as per question, okay. If same anatomical area, the provider is documented, I have debrided left arm, subcutaneous as well as the muscle. Okay. Do we need to code subcutaneous level and also muscle level different?
No, muscle
Yes.
only.
Yeah,
The most
no Vikram. You can pick the deepest level, which is muscle. Okay, no need to code subcutaneous and muscle, two codes for same anatomical area. Please go ahead with the depth. Okay, clear?
yes.
Okay. And remember, you should not append the 59 modifier to the primary code, correct? As I told yesterday itself. You guys remember that, right?
Yes, yes.
Okay. That is very important, guys. Don't do blunders. We don't do like concept errors. We know it, but uh, blunder, we won't check it as per that question. We will mark it. Okay, I know this. This is correct answer like that. But we are like in the reality, we will be doing the blunders. I'm also the one of the person when I am practicing the mock. Okay, don't do that.
Primary in the sense, if we have add-on means we should append with add-on.
59 modifiers we can add, we can code it. But for primary codes, you should not code it. Clear?
If there is no add-on means,
Subsequent codes. If there is no add-on and subsequent codes, why we need to add 59 modifier? Only single procedure being performed. Okay, no add-ons, no subsequent codes. Why we need to add 59 modifier? No need, right?
For Medicare, get
యశ్వంత్ అర్థం కాదు
for Medicare.
అర్థం కాల మెడికేర్ అనేది అర్థమైంది యువర్ క్వశ్చన్ ఈజ్ నాట్ క్లియర్ ఫర్ మీ యశ్వంత్
Can we append any modifier for Medicare patient?
yes we have discussed that as well excess modifier
Yeah, okay, okay, good.
instead of
Thank you.
59 you can add the excess modifier in only that concept which I have explained just before
Okay, okay, okay. Thank you.
yeah thank you Yashwant okay next we'll move on to the topic repair okay what is meant by repair when we can code repair in which conditions we can code repair yes రిపేర్ అంటే ఏంటి అసలు ఫస్ట్ ఓకే బిఫోర్ వీఆర్ లర్నింగ్ రిపేర్ ఐ కెన్ ఆస్క్ ఏ క్వశ్చన్ వాట్ ఈస్ లాసరేషన్
Cutting.
కటింగ్ ఓకే
Remove the person applying the sutures.
Okay. I just want to show you the pictures. You can, it is a deep cut. Okay. Lastration in the sense, it is a deep cut. You can see deep cut. For this, the repair is needed. Okay. Repair in the sense, what they will do in the name of repair. What provider is gonna do? How they can repair that deep cuts or deep wounds? Hmm? Like normal ga, you guys have seen, right? If it is a deep wound, what the provider is gonna do? Right?
Suture.
Suture. Ah, may like major thing we can see that, right? Normal గా ఏమన్నా అంటే కుట్లేసేస్తున్నారు కుట్లేసేసారు. Okay. Other than that, sutures. Hmm?
Stapler like thing. Tape.
Okay.
Close the cutting layers, ma'am.
Hmm. ఎలా క్లోజ్ చేస్తారు? How they will be how the provider is gonna close it?
With sutures.
Oh, okay. Only sutures have you guys seen so far? Not any other alternative closure? They will use these sutures, staples, and gum also nowadays. Have you seen, guys? Not nowadays.
Yeah,
It
yes,
is from so many days. They will use the gum also. Okay.
yes, I saw it. Yes.
Yes. Okay. Here for the deep cuts, the provider is going to do the repair. Okay. What they will do in the name of repair? They will use the sutures. Okay. Suture means which with a thread. Okay. Staples means normal. We will use the paper staples, right? Like that only. Skin staples will be there. They will use the skin staples and they will close the deep wound. Okay. This is another type. And also tissue adhesives. Example, like they will use the tissue. I'll show you the picture. Wait. Like this. These are the tissue adhesives. Okay. Sutures and staples already you might have an idea. So I'm not showing it. Okay. And either singly or in combination, they may use it. Okay. Sutures and tissue adhesives, they may use staples. Like together, they may use it. Okay. In order to close that deep wound. Next, what are the types of repair we have? We have the three major types of repair. Okay. First one, simple repair. Second one, intermediate repair. Third one, complex repair. If you have notes, please write it down. Simple repair, first one. Second one, intermediate repair. And also last one, complex repair. And for all these three repairs, we have the like terms, normal terms. How can you remember? It is a simple repair by reading the documentation. Like that kind of words I'll be explaining. Okay. Simple repair. Here, nothing but they will be closing the superficial layers. What are the superficial layers? I already explained. What are the superficial layers of the skin? Yes.
Epidermis dummies.
And
The
subcutaneous also you can take it. Okay. If the wound until subcutaneous level. Okay. If the provider is performed closed epidermis, dermis, and subcutaneous layers until these layers, if they perform the repair or done the repair for these layers, which is superficial layers, you can code simple repair. Based on the depth only, you have to code it. Okay. Simple repair, it is a superficial layer closing. Okay. Blindly, you can remember like that. Superficial layer closing, simple repair, and also simple one layer closure. This is one term you can remember, and you can also write it that down. Simple one layer closure will be considered as the simple repair. Clear, guys?
Yes, ma'am.
Yes. One layer closure, which is simple repair. And here you can see hemostasis and local or topical anesthesia. If they have performed any local anesthesia in order to numb that particular area. Okay, now suture cheyadaniki like that particular place should be numbed. Like they have to use the any local or topical anesthesia. So here you should not quote the additional code for the anesthesia. Okay, it is mandatory to use it. So no need to quote the additionally for the local or topical anesthesia for the simple repair. This is also one of the major point you have to remember and write it down. Guys, honestly say that you guys are maintaining notes. Out of curiosity, I'm asking.
Yes.
Oh, thank you, Sachin.
Yes, yes.
Boys, I don't trust you. I don't know why.
Seriously, Gita, we are maintaining.
Okay. Mhm. Okay, so guys, I'm just kidding. Okay, next, intermediate repair. Okay, intermediate repair, we do have like two to 3 points to remember. Okay, how can you identify it is a intermediate repair by reading the documentation or question? Okay, guys, if it is a single layer closure or simple one layer closure, blindly don't follow that term alone, but read before and after that also. Like how we are going to do the question, it is there, the question. It is a single layer closure. You have seen this term anywhere in the question, but you are missed to read after that. Okay, there it is a blunder. Okay, when you are answering a question, make sure that you have read every line of the question. Okay, don't do this kind of blunders, which I have done it. Okay, here, sorry, is there any?
No, I said yes.
Okay, okay, Shwan, thank you. What are the terms we can remember for intermediate repair? Okay, let me tell you. Here you can see if you have CPT book with you, kindly highlight it. Okay, here intermediate repair requires layered closure of one or more of the deeper layers of the subcutaneous tissue, superficial, non like muscle will be involved. No, only subcutaneous level, but it is a layered closure. Okay, layered closure. There you can quote the intermediate repair. 1 minute.
Hello, madam. Undermining, minimaling, consider intermediate.
Sorry. Extensive undermining comes under complex repair, not the intermediate repair. Okay, extensive cleaning will be coming under intermediate repair, but extensive undermining coming under complex repair. Clear? Am I clear on this point?
Yes, ma'am.
Yeah. Okay. Intermediate repair, please write this down, requires layered closure of one or more of the deeper layers of the subcutaneous tissue and superficial fascia. It is not muscle
Difference.
fascia. It is a non-muscle fascia. Okay. Muscle is not involved here. And another point, single layer closure of heavily contaminated wounds. What is contamination? What does it mean, contamination? Guys, what is meant by contamination? Infection. Okay, heavily like contamination means you can consider it is a infected wound. Okay, so single layer closure of heavily contaminated wounds that requires extensive cleaning or removal of particular matter. What is meant by particulate matter? Like which is a foreign body. if there is a foreign body present, like there is a deep cut, okay, but we don't know how it happened to the patient. If there is any foreign body or gas pieces is retained in the wound, in order to remove that, if there is a requirement of the extensive cleaning, okay. సో ఏదైనా గుచ్చుకుందంటే దాన్ని తీయడానికి మనం ఇంకా కొంచెం పెద్ద చేస్తాం కదా wound, like that the provider is gonna do that extensive cleaning or removal of the foreign body. Particular matter means it is a foreign body. Okay. So here you can consider it is a intermediate repair. Clear? Guys, clear?
Yes, yes.
Yeah. You can write all these three lines which you have under intermediate repair. Okay. Single layer closure until here also constitutes the intermediate repair. These are the terms. You have to check it for the intermediate repair. Okay. If you are good with the simple and intermediate repair, we can move on to the complex repair. Can I move on to the complex repair?
Yes, ma'am.
Yeah, okay. Here, complex repair means there is a chance of exposure of the bone also. That much deep cuts. Okay, that much deep wounds. Okay, cartilage, tendon, or any neurovascular structures is exposed to external environment, and you can the provider can also see the bone outside of the skin, like that. These are the complex. If they have done any wound repair, you can consider under the complex repair. Which repair? Complex repair. And what are the terms you have to remember for the complex repair means? Layered closure only. Here we have 1 minute. If we could show- No, we don't have here, but I have the terms. Okay, let me explain. Layered closure. For complex repair, I'm explaining the terms, guys. Layered closure, in brackets, you can keep it multiple layer closure. Okay, layered closure means in bracket, it is a multiple layers. What are the multiple layers? Epidermis, dermis, subcutaneous, muscle, like all these layers being stitched. Okay, multiple layer closure with scar revision. What is meant by scar revision? What is meant by scar first? Scar. What is meant by scar? Hmm? Okay. Mm. No, no, no. Not like this. Here we don't get a proper image for my explanation. Okay. Scar revision means if they have done anything to the previously patient already do have the scar because of any injury like that. If they have done that scar revision, like they have repaired it again like that due to any injury, so you can consider it is under the complex repair. Next, stent placement or retention of the sutures. What is meant by retention of the sutures means if the patient underwent the surgery but the sutures is retained under the skin. Okay, in order to remove that, if they have done the like removing the retained sutures and scar revision, and also yeah, after this procedures, if they have done the layered closure, which is multiple layer closure. Okay, in this scenario you can you can code the complex repair and also extensive undermining. Okay, please remember extensive undermining. This term comes under the complex repair, not the intermediate repair. Extensive cleaning comes under the intermediate repair. Clear? Am I clear with the terms for all the three repairs? Yes or no, guys?
Complex repair term, please repeat, ma'am. I try to.
Okay, no issues. I'll repair. I'll repeat. Okay, here the complex repair where we can see where all deep structures been involved for repair. Which is what are the deep structures? Bone, the exposure of the bone, cartilage, tendon, like that any vascular like blood vessels being exposed to external environment through the skin. So for this kind of injuries, if the provider has done the repair, you can consider that as a complex repair. Okay, this is first thing you have to remember. Next, layered closure, which is multiple layer closure, which has the and also the term you can see scar revision. Scar revision, SCAR, scar revision, and also removed retained sutures. Okay, and if there is a extensive undermining, okay, if the provider has done the extensive undermining, that time also you can consider that as a complex repair. Clear?
Yes, ma'am.
Okay, thank you, Baliram. Any other questions, guys? We can go ahead and see the codes if you are clear. Yes, no.
Ma'am, if they mentioned layered closure with foreign body at that time,
You can directly go with the intermediate repair.
okay.
Yes. Okay. Any other question? Thank you, Ashwant. Any other
No,
questions?
Gita, I'm fine. Thank you.
Thank you. Ravima, I'm expecting question from you. Any question?
No, Geeta. Good to go.
Thank you. Yeah, thank you. Okay, guys, I'll move on to the quotes now. We can see the simple, intermediate, and complex repair. Different code set we have. Not all together. We do have the different code set, and based on the anatomical area, the codes are varied, and the square centimeters, not square centimeters, centimeters. Okay. Here, we can see what is the already we discussed yesterday itself. No need to go. Yeah, 12001. Okay, 12001. Simple repair of superficial wounds of the scalp, neck, axilla, external genitalia, trunk, or extremities. Okay, 2.5 centimeters or less. Let me ask you questions. Okay. Here the code set for the 12001 anatomical area until 12004. Okay, over 30 centimeters. Until there you can code it. Let me give you one scenario with like a question. Okay, if the provider has done the simple repair in this like on scalp 3 centimeters, on scalp 3 centimeters, trunk 10 centimeters, trunk 10 centimeters. Extremity, like right leg, the provider has done simple repair 20 centimeters. Okay. Now tell me what is the, like, what are the codes we need to quote?
12007.
1207.
006, ma'am. 6.
Uh,
007, ma'am.
how many centimeters altogether?
Well, 33 centimeters.
7.
Then how come we can quote the 12006?
Mistakenly.
Okay. No issues. Okay, let me give you another example. If the trunk, the provider performed 4.5 centimeters, simple repair.
Madam, 12002.
If it is 1 centimeter,
One.
One.
1.
One.
correct. Simple repair of superficial wounds of the face, ears, eyelids, nose, lips, and mucous membrane. Here, the anatomical areas are vary, but the repair is same. Okay, based on anatomical areas only, the code set are different. For example, let me ask you a question. Simple repair done on external genitalia 3 centimeters. Another repair, the simple repair only done on eyelid 1 centimeter. Okay, how can we code it?
Two different codes.
Sorry.
Two different codes, ma'am. Anatomical area is changed.
Ah,
So we
okay,
can
what
put
are the codes? Yes, Baliram, that's correct.
12002 12011.
Yeah, here one modifier is applicable. What is the modifier is applicable?
59.
It is a same level. Like repair is same, not a intermediate repair or complex repair. Any other modifier? Can anyone try? Huh? Which one?
76.
No. Any other
51.
modifier? Ah, Kutti?
51, ma'am.
Yes. 51 modifier. To which CPT you can append the 51 modifier here then? Here someone said the code for my question 12002 and 12011, correct? Here first you have to code the higher code which is 12011. After that 12002. Okay, and for 12002 you have to append the 51 modifier. Clear? Because it is a same level, like a same repair, same level repair. Okay, simple repair. For example, if they performed a simple repair on a scalp 3 centimeters. Okay, scalp 3 centimeters. Intermediate repair performed for axilla 5 centimeters. Modifier also applicable, not 51. Do you want me to repeat the question?
Can you please repeat the question?
Yes. Simple repair done for on scalp 3 centimeters. Okay. Intermediate repair performed on axilla 5 centimeters.
12032.
Okay.
And 12002.
Okay. What
59
is the modifier,
modifier.
Kutti?
59, ma'am.
Everyone agree with Kutti here? No.
Yes, ma'am.
Yes. Guys,
Yes.
everyone agree with Kutti?
Yes, Vita.
Okay.
Yes.
Thank you. Yeah. That is how you need to code it. Okay. And I do have terms for when to code the repairs, when not to code the repairs. Okay. If the provider performed or given only adhesive strips, okay, only adhesive strips or steri strips, write this down, guys, the points. Okay. Application of adhesive strips, steri strips, band-aid, like these terms have you seen, don't code the repair. Don't code the repair. Okay. You instead of coding repair, need to code the ENM. Can anyone repeat the point which I have said just before?
Yes, ma'am. Can you repeat it again?
Kuti, I am asking you guys to repeat the point.
So if repair is done by adhesive strips, so we should not give repair code. Instead, we should code EMF.
Other two also is there, Ravima. Adhesive strips is correct. Next, steri strips.
Band.
Band-aid. Steri strips and band-aid not to be coded repair. Instead, you have to code the normal ENM code. Write this down, please. Sorry, guys. Written the point. Yes or no?
Yes.
Yeah. Next, application of strips is not included in repair. Okay. Already I have explained that. We need to code the EN. If the provider is given suture plus strips, okay, then suture placement like eligible for the repair. Okay, we can code it. But suture plus strips, you can code the repair. Okay, only strips you should not code the repair. But suture plus strips, we can code the repair. Okay.
Okay.
Clear when we need to append 51 modifier, when we need to append 59 modifier. If you are not clear, like no, you are clear as of now, but write that down when to add the 51 and 59 modifier. Later you may forget. Okay.
Okay.
Okay. Can I move on to the next topic? If you are good. Do you have any questions? Please go ahead.
What about the Medicare and non-Medicare things?
If it is different anatomical area, like a different depth, you can add the excess modifier only, Ishwant. No other modifiers is applicable because all other is different, right? Only excess modifier may applicable. And also remember, all four modifier we have Medicare, right? Apart from that four scenarios, if you are encounter for Medicare patient, అంటే అవి కాకుండా మీకు ఏమైనా అదర్ సినారియోస్ వస్తే మెడికేర్ పేషెంట్కి యూ కెన్ స్టిల్ కోడ్ ది 59 modifier for Medicare also because we don't have the exact code or modifier for that scenario means you can go ahead with 59 modifier only for Medicare also. Everyone
The
clear?
CPT is also same.
CPT is same. Only modifier change. Guys, for Medicare patients, CPTs is not gonna change. No. Only modifier, that too for 59 only we have replacement. For all other modifiers, you can still code for Medicare same. Okay? Yes. Ashwant, clear?
I think we can give G series CPT for Medicare patient. Can you please check?
What are the G series codes for repair?
As per my knowledge, for
Yeah,
non-Medicare
we do
only, we
have G
can use
series,
one,
but
two. Yeah, yeah.
yeah, we have the G series for Medicare patient, but only
Okay,
few scenarios we have. For every scenario, we don't have G series.
okay,
Yes, few scenarios we do have G series. We need to bill for Medicare. For commercial, we need to bill the CPT. But not all the scenarios. If there is a G series, I'll be explaining that also. Okay.
okay, Gita.
Yeah.
Because I'm an AD coder, as per my knowledge.
Yes. There is a G code.
Yeah,
Mm.
that's what.
Yes,
Okay, Gita,
there is.
thank you. Can you please
Thank you.
continue?
Yeah. Guys, clear with the repair and debridement in the integumentary system? Can I move on to the next topic? Yes.
Yes, yes.
Thank you. Yeah. Please tell me what is meant by critical care services or ICU when we can see the critical care services. What are all the critical care services? Ashwant, as you said, you are ED. You know, right?
Yes, yes, Gita.
Yes,
If
when we
condition
can
will
quote
be
critical care
critical,
services.
like if patient's condition will be critical, like fractures or skull fractures
Mm-hmm.
and cardiac arrest,
Mm.
sepsis, these kind of scenarios we can they can apply the critical care.
Yes, you are correct. Like where the patient is critically ill or injured patients. Okay, critical ill means there is a severe conditions we might have, right? Like patient might have the cardiac arrest or a myocardial infarction. Okay, any brain dead like CVAs. What is meant by CVA? Cerebrovascular accident. Okay. And any chronic illnesses and the condition which is already exacerbated. What is the exacerbation is nothing but like, if patient has the hypertension. Okay. For hypertension exacerbation, increased blood pressure. Okay. Even though patient is on medication, there is a increased blood pressure. If patient has the diabetes, even though patient is on the, treatment, increased sugar levels. Like the symptoms are increased, the condition is exacerbated. Okay, those condition our patients will be there in the ICU setting. Okay, intensive care unit, critical care services. Clear? And we do have two codes, only two codes for the ICU code, critical care services. What are the two ICD codes? Sorry, CPT codes. I am really sorry. Two CPT codes. 99291 and 99292. Okay, what is 99292? Add-on code. Okay, since there is a plus symbol in front of 99292, it is an add-on code. 99291, which is critical care evaluation and management of the critically ill or critically injured patients, first 30 to 74 minutes. Okay, okay, let me ask you one question. If the patient is like exacerbated hypertension, okay, and patient in the critical care, the provider spent 20 minutes for treating that particular patient. What is the code we can quote?
We cannot code with something.
Ishwant, 1 minute. Others also can answer.
No code, ma'am.
Why no code, ma?
We consider as a 30 minutes, starting from 30 minutes.
Mm-hmm. Okay, generally, why can't we code for 20 minutes? Like general. 。 No one can treat a critically ill or critically injured patient within 20 minutes. Okay. So minimum 30 minutes. You can start coding ICU cares or critical cares codes from the 31st minute. Okay. From the 31st minute, you can start coding the 99291. For first 30 minutes, please don't code the critical care services. And also we have the time chart here. Based on the time range, you can code the codes. Okay. And additional 30 minutes. Okay. Here you can see less than 30 minutes, no code will be from the critical care, but instead you can code the appropriate ENM codes. No need to code not like that. You can still code it, but not the critical care codes. Instead of that, you can code the appropriate ENM codes. Clear? Clear? Yes or no, guys?
ENM code in the sense 99214, like that you are saying.
That code
Office.
range you can. Based on, like, if it is a inpatient, you can code inpatient codes. If it is outpatient, not outpatient, for generally, like it is a critical care, right? Most of the time, it will come as a inpatient codes only. Okay. It is what you said, it is a outpatient moderate evolution and management code. Correct, Ravima? You are from ENM coding?
No, I am purely HCC.
Oh, ICD coding. Okay.
Yeah.
Oh, clear. Clear, guys. The critical care codes. Still, we have the some topics to be discussed. Clear with the 291 and 292 when we need to code. If it is less than 30 minutes, don't code critical care. Instead, you can code the appropriate ENN code. Most of the time, it is the IP code, inpatient code. Okay, based on the time range, you can start coding the 99291 and 99292. And one more thing I just want to discuss here. Here, for the critical care, some are the procedures or services already being involved, like already being included in that services. What are the included services? Let me explain. Please write that down again. Okay. Next, first one, interpretation of cardiac output measurements. The interpretation of cardiac output measurement, which is 93598, chest x-rays, which is 71045, 71046. Okay, pulse oximetry, 94760, 94761, 94762. Okay, next, blood gases and collection and interpretation of physiological data. Example, ECGs, electrocardiograms, blood pressures, hematologic data. These are all included. Gastric intubation, which is 43752, 43753. Temporary transcutaneous pacing, 92953. Okay, ventilatory management, 94002, 94004, 94660, 94662. And vascular access procedures. What is meant by vascular access procedures? In the sense, like IV cannulization, like like they will insert the cannula into the venous. Okay, so for that venous access, vascular access procedures, which is 36000, 36410, 36415, 591, 36600. These all are inclusive in the ICU setting, which is for ICU care. Let me ask you, can we code 99291 and also 71045 together? Do you want
No,
me to repeat? No?
it is included. X-ray is included in critical care.
Can we code 99291 and also 36410? Guys, can we code?
No. Vascular access
Yes,
procedure.
vascular access procedures. These are all the vascular access procedures. So we should not code the 6361. Like these all are CPTs. You should not code along with the 99291 and 292 codes because all are inclusive. If there is no inclusive procedure here, still you can code additionally along with the critical care. What are all these CPTs which is not there here? You can code it additionally when it is performed in the critical care setting. Am I clear? Guys, am I clear? Do you want me to repeat any point here? Am I audible?
Okay, sir, clear.
Thank you.
Clear, ma'am.
Okay, thank you. Okay. Can I move on to the next topic now? Can I move on to the next topic?
Yeah, ma'am.
Okay. We can discuss foreign body removal. What is meant by foreign body removal? From the eye, okay? From the cornea. And what is cornea? 1 minute. I'll explain the basic anatomy of the anatomy classes is completed for you guys. If yes, I'm not gonna complete. Yeah, I'm not gonna teach now again. If no, I'll be showing the eye anatomy again. Yes, no? Can anyone tell me anatomy classes is completed for you? Sometimes I feel like I'm talking in mute. Hey, Ravima, Yashwant.
No, ma'am.
No, anatomy class is not completed.
No.
Okay, yeah, no issues. Let me tell you here the eye anatomy. Here you can see the layer, right? That is conjunctiva. Okay, white color. Here you can see this is the ciliary body. Next, here you can see choroid, okay? And the brown color layer, the line, retina, okay? That line is retina, where you can see it is in the back side of the eye only, not front side, okay? Front side, it is becomes the uh, ciliary body. Okay, ciliary body, and followed the front side is the ciliary body, back side it will become the retina. Next, the bump, little bump is there, right? That is macula. Okay, this bump is called macula. It is the vitreous body. This space you can see, that is vitreous body. And optic nerve. Okay, what is the function of nerve? What is the function of nerve?
Neuron conduction.
Okay. It will send the signals from the eye to brain, right? So that is optic nerve. Okay. Only without brain involvement, we can visualize and we can conclude what we are watching actually. Okay, if you are seeing tree, that should be concluded by brain. If you are seeing any animal or dog like that, so it should be concluded by the where the vision area present in the brain. Okay, so this optic nerve continues to the uh, vision area in the brain. Next, optic disc here. Okay, here you can see it is a cornea. Okay, this one is pupil, black color one. Middle, we can call it as pupil. Okay, next this one is iris. Cornea, this is cornea. Okay, white color layer, that is cornea. And anterior chamber, this one is anterior chamber, this one is sclera. Okay, you can remember two major parts here, which is cornea, this is cornea, this is conjunctiva. Okay, cornea and conjunctiva. We can discuss the foreign body removal in the cornea as well as conjunctiva. Clear? Clear with the anatomy of the eye? Here we
Yes,
have the
Geeta.
code. Thank you. Hmm. Here we have the codes, which is 65205. Can anyone read out what is the description of 65205? 65205.
Removal of
Removal of, yes, Ravima, go ahead. I thought so.
foreign body external eye, conjunctival, superficial.
Yes, superficial. If they are removing any foreign body from the conjunctival area of the eye, superficial, you can quote the 65205. Okay. No. Next, cornea, from cornea. How can we read the description of 65210?
Removal of foreign body external eye,
Mhm.
conjunctival embedded.
What is meant by embedded? What is meant by embedded?
Adding to that together to also include like include subconjunctival.
Embedded means it is like stick to the foreign body is stick to conjunctival area. Okay, so that there when they are performing removal of foreign body and it is already embedded to conjunctival area and or subconjunctival or scleral non-perforating. Perforation means what is meant by perforation?
Going through.
No, not really. A hole. Okay. Without a like perforation means hole, making a hole. Okay. Scleral non-perforating. There is no damage to the scleral area. Okay. Then you can quote the 65210 when foreign body is embedded to the conjunctival area, but there is no scleral damage, non-perforating. If it is a perforating, there is a damage to scleral area. Okay. Clear? Perforation means it is a hole, ma, and like in other terms, we can consider it is a damage. Okay, ma. Next, corneal foreign body removal. Corneal foreign body removal. What are the codes we have in the here? The corneal foreign body removal. Hmm?
65220,
Uh-huh.
65222.
Yes. 65220 and 65222. Okay, these are the two codes which we have for the corneal foreign body removal. What is without slit lamp and what is with slit lamp? What is meant by without or with slit lamp? Yes. Nothing but the provider is going to use the instruments, okay, using the tools to remove the foreign body, that is with slit lamp, which is 65222. What the provider is going to use? The tools to remove the foreign body in the corneal area. Then you can code the with slit lamp, okay, which is 65222. And when we can add without slit lamp? Quite opposite, right? If simply the provider is removed the foreign body from the corneal area, you can go ahead and code the 65220. If the provider used tools to remove the foreign body in the corneal area, you have to code the 65222. Clear?
Yes, ma'am.
Okay. Next, when the if there is a foreign body and they have removed foreign body, but there is a laceration caused by foreign body. What is the code we need to code for corneal area? Corneal laceration. If someone is reading here completely the code description and the notes, you are going to say the no code.
65275.
65275. That is correct. Yeah. For repair of corneal laceration with foreign body, use the 65275. Here you can see the description. Cornea non-perforating with or without removal foreign body. 1 minute. Sorry. How can we read the 65275? We need to code here repair of laceration. Hey, sorry, yaar. 1 minute. Cornea repair. 37. Yes. Until semicolon, repair of laceration, cornea non-perforating with or without foreign removal of foreign body. Okay. Here you can code this. For example, there is a laceration. Okay. Laceration which is caused by the foreign body. What are the codes we need to code? And also the provider is performed foreign body removal in that particular same session only. Done the repair, corneal repair done, and also removed the foreign body. Guys, do you want me to repeat the question?
Geeta, can you please repeat the question?
The provider repaired the cornea laceration, okay, and also done the foreign body removal. What are the codes we need to go?
65275.
65275.
Why can't we code 65275 and also 65222 or 65220? Two codes. Why can't we code it?
So 65275 include both the repair and the removal of foreign body. So why
That
should
is
we?
correct, Ravima. Yes, everything is being included in the 65275 alone. Okay, no need to code additional codes like a 65220 or 65222. Okay, when we can code these two codes then only the foreign body removal without a corneal laceration. Clear?
Yes, ma'am.
Clear,
Clear.
guys?
Yes, ma'am. Clear.
Okay. This is the foreign body removal of the cornea and conjunctiva. Okay. Next, we'll move on to the another topic. I'll close with another topic, guys. Okay. Hmm. Here we can discuss the removal of foreign body foot. Okay. Here also based on the level and the deep or complicated. We can discuss. Okay. Here we have the three code set which is 2819029, 2819229, These are the three codes which is used for the removal of foreign body in foot, only foot. Okay. And if it is a subcutaneous level, like if the foreign body there in until subcutaneous level only, if they have removed that foreign body, you can go ahead and code the 28190 followed by 2828192. When we can code 28192? Yes. When we can code 28192?
Foreign body removal is in deep means two layer close.
Deep means what are the structures which is there in the deep of the skin?
Layered close. Like
That is repair. What are the layers? After subcutaneous layer, there is no layers we have in the skin.
Muscle,
Okay, Suchitra.
muscle and bone.
Mm-hmm. Yes. Muscle, tendon, okay, cartilage and bone. These levels, okay, if they have performed the foreign body removal in the muscle, okay, tendon or bone level, then you can go with the deep. Clear with the 28190 and 28192? I'll move on to the 28193 if you are clear with the top two codes. Guys?
let's get up.
Okay. Complicated. 28193 complicated. When we can code 28193? When we can code 28193? Guys, do you have any idea when we can code the complicated?
No, ma'am.
Here you can code the, like if it is repaired with layered closure or the suture placement becomes the complicated. Okay. If the provider is used sutures after removing the foreign body, then you can consider it is a complicated foreign body removal. And also, when if the provider is performed the layered closure repair, then also it is complicated. Okay, clear? What are the foreign bodies, guys? Like I am keep on saying foreign body, foreign body, foreign body. What are the like what is meant by foreign body? What are the foreign bodies which we can see more often? Normal in day to day lifestyle. Glass, any glass particles, metal particles, okay, any wood particles, okay, it is embedded into the skin, then it is a foreign body. Okay, clear?
Yes, ma'am. Yeah.
Okay. One minute. I'll move on to the next topic. This is last. Tell me. Foreign body removal of the normal skin depth also we do have codes. Generally, I'll summarize the codes alone. Simple and complicated, I have explained. Complication means the suture placement becomes the complicated. Okay. They have removed foreign body simply means it is simple only. No suture placement that time. If the suture placement is becomes the complicated. Yeah. Incision and removal of foreign body, subcutaneous tissues, simple. You can go with the 10120. Complicated, so the suture placement becomes the complicated and the multiple abscess like that. If there is anything, you can consider it as a complicated. Okay, these are the two codes. Normal foreign body removal of the until subcutaneous tissue level. Simple and complicated means suture placement. Okay, clear? Foot and also cornea, conjunctiva, we have discussed separate code set, correct? This is normal, not a foot like that. Subcutaneous level, we can code the 10120 and 10121. Okay. Simply, I'll discuss laparoscopic codes. If you have doubts, we'll discuss. Still, I have 10 minutes. Okay. Before I'm going to discuss laparoscopic prostatectomy, okay? I just want to know the terms of meanings, okay? What is meant by incision? What is meant by excision? When we can code laparoscopy? Can anyone? What is meant by ectomy? What is meant by otomy? All these term meanings. Already we do have senior coders in this class.
Excision means cutting, ma'am. Ectomy means removal.
Okay. Excision means removal also, right? What is the difference between excision and ectomy then? Hmm? Similarly, both are same. Okay.
Well, ma'am. Excision
Ah,
means
Goody?
cutting off the part, one part.
Yes, excision or ectomy, both has the similar terms, meanings. Okay. Next, what is meant by incision then? What is
Cut,
meant by incision? Sorry, Ravima.
cut open.
Making an incision, yeah, opening of the, like making an opening on skin. So that is called as incision. What is meant by ostomy and otomy?
Artificial open.
Ostomy. Yeah. What is, for what you are saying artificial opening? For ostomy or otomy? Okay. What is artificial opening other term?
Only procedure purpose you can open the body part, ma'am.
Mm-hmm.
After
What is the
complete,
medical term? Ostomy or otomy, that procedure or
It
service?
is
Ah,
ot-
sorry, Ravima.
the one she's saying is otomy. So artificial opening is ostomy.
Otomy means then?
It is simple incision to cut open. That is otomy.
Okay. What is clear difference between ostomy and otomy then? Ostomy is a artificial opening, right?
yes, ma'am.
That is ostomy. What is otomy?
Incision.
Any other answers? Guys, any other answers? Here, I'll tell you the clear difference between the ostomy and otomy. Ostomy, in the sense, it creates a new opening, okay? New opening to the internal organ. That, like artificial opening for the internal organ. That is the ostomy. Whereas otomy is making an incision or a cut into the internal organ. That is called as otomy. Okay, I'll explain the terms again. Okay, whatever I have asked just before. Excision and ectomy both has the similar terms, which is removal. Okay, incision, making a cut on skin, that is incision. Otomy, making an incision in the into the internal organ, that is otomy. And ostomy is making an artificial opening to the internal organ, that is ostomy. Okay, what is laparoscopic? How can we identify the surgery is performed through laparoscopic or open? What is the clear difference between open and laparoscopic surgery? What is the clear difference between open and laparoscopic surgery? Yes.
Laparoscopic is a visualizing procedure, ma'am. Like monitors.
Okay. They won't perform surgeries?
Perform surgery purpose only open, ma'am.
No, I'm asking. Through laparoscopy, the surgeons won't perform the surgery. Only they will visualize the internal organs.
No, they will do the surgery too.
Yes, they will do the surgery too through the laparoscopy, correct? What I'm asking, how can we identify either the surgeon is performed the surgery through open or laparoscopy? That is the question. How can we identify based on the scenarios or the questions? How can we identify either it is open or laparoscopy? Hmm?
If it is like critical, they'll do the open surgery.
Not like that, Saujanya. If it is critical, why can't they make do the laparoscopic surgery? Can I tell you the terms? How can you identify open surgery as well as laparoscopic surgery? Can you please make the note? Yes. Quickly, we can close this.
Yes, yes, Geeta.
Yes. Open surgeries, we do have terms when, like, how can you identify it is definitely a open surgery like that based on the question or scenario. Okay. Incision. If they made incision, you can consider it is a open surgery. Next, IND, incision and drainage. IND. Then also it is open. Next, FB removal. What is FB removal? What is FB
Foreign body
removal?
removal.
Foreign body removal. Yes, it is open. Next, biopsy. You can consider it is a open procedure. Excision and resection. Excision slash resection. It is a open procedure again. And next, introduction or insertion. Introduction or insertion. Still, it is a open surgery, open procedure. Next, if they are mentioned removal, repair, dilatation, catheter or stent, like these terms you have come across during the you are reading a question, then consider that it is a open procedure. Clear? Do you want me to repeat again?
Yes, ma'am. Can you repeat it once again?
I'll list it. Is that fine?
Okay.
Okay. Incision, IND, FB removal, biopsy, excision slash resection, introduction or insertion. Next, removal, repair, dilatation, catheter slash stent. If you come across these terms, consider that as a open procedure. Okay.
Okay, ma'am.
And next, laparoscopic. Laparoscopic, here you can consider the terms based on use of laparoscopic instruments. Okay, if they have mentioned like instruments are inserted through the skin into the organs like that, instruments, laparoscopic instruments. And ports, which is PORT, ports are trocars, like TROCAR, trocars. Placement, this is another term. Okay, C for CO2 insufflation, INSUFLATION, CO2 insufflation. Next, they will directly mention lap surgery. Okay, these are the terms. Did anyone wants me to repeat the points again? Guys? Anyone wants me to repeat these laparoscopic points again? Or are you guys good? Quick, guys.
No, no, Gita, we are fine.
Thank you, Ishwant. Next, what are the most common procedures you can see means laparoscopic cholecystectomy, laparoscopic bariatric surgery, hernia repair, appendectomy. Okay, these are the common procedures which you can see through the laparoscopy. Okay.
Okay.
Okay. And that's all from my end today, and we can discuss leftover topics tomorrow. Okay.
Okay, ma'am.
Thank you so much, guys, for your
మ్యామ్
patience
లాస్ట్
from
చెప్పారు కదా
7:30 to
ఒకసారి చెప్పండి
9:30. Sorry,
గీతం
Maurya. Maurya, you are here.
ఎస్ మ్యామ్